Hello viewers, I'm Sangeeta Kopalkar from Sargam TV, and today we are here to meet a very famous popular eye specialist, Dr. Sarb Hundal, who is the director and owner of Mission Valley Eye Center in Fremont. So let's meet the doctor and ask him a lot of questions about eyes and eye ailments and all that. So, hello doctor, how are you?
Good, how are you today?
Very good, and so nice to see you.
Good to see you too.
Okay, so can you tell us about yourself, how many years you are here in this practice and in this particular clinic and hospital, as well as your studies?
Absolutely. Well, first of all, I finished my medical school back in India, in Patala, and I came to University of New York in Buffalo in 1976. So I did my ophthalmology and my pathology residency there for 4 years. And then I came to Chicago. I was at the University of Illinois for 2 more years. Did my fellowship in retinal surgery and vitrectomy surgeries. And then I decided to move to California. It was too much to live in the snow for too many years.
Oh, that's true.
So in 1982, I started my ophthalmic practice in Stockton and Modesto. But I didn't like living there. It was kind of boring, so I decided to move to the Bay Area in 1984. And in 1990, I built this place. I got the building, built the surgery center and the clinic. So this place has been in action since 1990.
Wow, that's pretty long time.
Long time already, yes.
Exactly. So, tell us about some common and serious eye problems and maybe how to treat them.
Absolutely. Well, first of all, here at the Mission Valley Eye Center and Mission Valley Surgery Center, we are fortunate enough to have a comprehensive center. We are basically equipped with optical, medical, and surgical facility. So any patient who need optical care, that is, they need glasses or contact lenses, we can do that. Patient need medical care of the eye, we can do that. And patient need surgical care, of course, we can do that. But to give you some idea, the common and serious eye illness that people come in for, those are primarily the cataract, glaucoma, diabetic eye disease, and the so-called aging macular degeneration.
Oh, okay. And what exactly is cataract?
Cataract perhaps is one of the most common eye disease which makes your vision go down, and it's probably one of the most common in our communities, especially from India.
Oh.
Cataract basically is a clouding of the lens of the eye, and it makes it harder for you to see. It's difficult to drive, difficult to read, difficult to watch television, and the treatment is basically surgical because there's no medication that can correct the cataract. So once it starts making your vision blurred and the doctor can diagnose it, then cataract surgery with the lens implantation can be done. It's an outpatient surgery, and you're going to see back to pretty much normal again.
Okay. And all these things, are they covered by insurance? Or?
Yes, absolutely, because it's a medically necessary surgery. So cataract surgery with lens implantation is covered, unless you want a so-called premium lens. A premium lens is patients who have cataract surgery, they can have the option that they don't have to wear glasses anymore. Not only distant, but even reading glasses, which of course older people have to wear normally.
Okay.
So those lenses are not covered. Those patient has to pay for if he purchases for the patient. But normal surgery with the normal lens implant, which means you still need some glasses afterwards, that is covered. Yes.
Okay. Great. And the second thing what you mentioned was
Glaucoma.
So tell us about that.
Glaucoma is a more serious condition. For example, the cataract, which is commonly known as Safed Motia in Indian languages,
Okay.
glaucoma is called Kala Motia. Glaucoma means that the pressure of the eye builds up, and that can then damage the optic nerve, and that damage can be permanent. So mostly patient doesn't realize they have glaucoma unless they have been examined by a doctor, and the vision decrease happens very gradually, and that's why glaucoma is more serious, because patient doesn't get help in time, and once they see the doctor, it may already have done a lot of damage, and you can't recover that damage. Treatment is basically medication. Sometimes you can use laser and surgery also, but in most patients we can control with eye drops.
Oh.
So examination of your eye early on is the best way to prevent it.
Okay, so that means you mean to say that maybe every 6 months or once in a year or something, the complete eye checkup has to be done?
Exactly. The rule of thumb is if you're 40 something, it's a good thing to have your eye checked once a year at least.
Okay.
That's the easiest way to put it.
Yeah, very true. So I hope the viewers are listening to this one. So once in a year at least an eye checkup.
Exactly. Good preventive way to do it. Precisely right.
And you did mention about diabetic eye disease. So is it related to diabetes, and does it do something to eyes?
It is absolutely, and that is one condition again where people mostly don't know. They have diabetes. Many patients don't check the level. They don't know what the sugar level is. Some patients don't take medication unless it's pretty bad. And unfortunately, diabetes also affects your eye. Diabetes basically affects the small blood vessel in the whole body, in your heart, in your kidneys, and in your eyes. So those small capillaries, they get clogged down, and then they can break down and cause bleeding in the eye. So unless the patient again has been examined on a yearly basis, we don't know if the disease is brewing inside the eye. The patient doesn't even know about it. And these days, the insurance companies have made it mandatory, though, that your family doctor will send you to the eye doctor every year to get your eye checked. So if we see the patient who has leaking or bleeding in the eye, now we have medications available that we can inject inside the eye to destroy those bad blood vessels so they don't bleed. And or we can also use laser, which can then coagulate those vessels or dry out those blood vessels. So it's a very treatable condition in the eye if you can catch it early. But if it's gone to all the way to cause massive bleeding, then the risk of blindness goes much higher.
So here also you mean to say the same thing, that checkup has to be checkup has to be done on
precisely yearly basis. Is a pretty good idea,
at least.
Right, right.
One more thing, what you mentioned was aging macular degeneration. What exactly is this?
That, at least fortunately, is not as common in Indian population, but still it's a significant disease process in most populations. As we get older, typically about 60 something, the back of the central part of the retina in the back of the eye, that tends to undergo aging degeneration. And that can gradually take away your central vision, And that's a pretty slow process generally. But again, if you have not been examined, we don't know what's going on, and you may be saying, oh, I'm just getting old, maybe my vision is supposed to go down a little. So it's good to have it checked early on. Again, treatment is available if you have the so-called wet macular degeneration, which means this degeneration has gone into leaking or bleeding of the blood vessels in the center. Then we have treatment available that's called, again, injection of anti-wedge factors into the back of the eye that can correct that bleeding or the leaking inside the eye, In the dry macular degeneration, the patient can generally take certain eye vitamins which can prevent the progression of the disease, So it's a treatable condition. Again, you should be looked at early on so it doesn't go too far,
Okay. So most of these cases what we discussed, these are quite serious. I can see that person can become blind, and then it can be total and uncurable blindness.
Absolutely. These 4 conditions, they are perhaps the most blinding conditions if the patient has not been seen by the eye doctor for a while. Of course, if they have been seen on a yearly basis, they can be detected early on and fixed. To add to that, though, there is also so-called vascular condition of the eye, which are related mostly to hypertension or high blood pressure, and sometimes uncontrolled diabetes. That affects the small veins and arteries in the back of the eye that can cause bleeding. The conditions are called vein occlusion or artery occlusion, and they also happen significantly in patients who have uncontrolled diabetes or uncontrolled high blood pressure. So those things should be looked at regularly and controlled. If I can give our audience a basic, simple, not cure, but sort of a good preventive measure as we're getting older, that is, as we get to 60 something, diabetes, high blood pressure, high cholesterol, it's going to hit us. And the best way to really control it, exercise, good eating habits, staying happy, Three most important
Most
things.
important.
So exercise, don't worry too much about stuff, and eat healthy. And you can prevent most of these things,
That's really nice of you. And one more thing what I want to ask you in
Yes,
addition to these is,
absolutely.
like, people who are, let's say, younger, they have not reached their 40 or 60s or whatever. If they have good eyesight, everything is good about the eyes, how can they maintain it? Or are there any basic few things that we can do and we can maintain our eye hygiene, or that we should avoid the
Good
eye
question.
diseases?
Good question. Of course, first of all, as a child, sometime at a kindergarten age or your elementary school age, it's a good idea to have your child checked by an eye doctor or a pediatrician to make certain that they're seeing good from each eye. Because there's so many conditions that can be there, you can be born with. If you don't treat them early on, your eye may not develop normal vision. So if you do not have any need for glasses, your eyes are fine, let's say at the age of 7 or 8, then it's perhaps not a bad idea not to worry about for the next few years, But once you are having a need for glasses or contact lenses at that age, then you should be seen on a yearly basis.
Okay.
Yeah.
Thank you so much, doctor. I am sure in addition to all these questions, there must be a lot of other things which can be talked about eyes and how to take good care of it if they are in good condition, and when something happens, what should be done. So probably we'll have to come to you again for the
Absolutely.
second interview.
Yes,
And
it's a very vast field to cover in one interview. We can
very
certainly
true, very true.
go there
So,
one more
but
time,
thank
yeah.
you so